Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is December 31st, 2020. As always, we'll start with the COVID-19 statistics. Worldwide, we have nearly 84 million cases and over 1.8 million deaths. In the United States, we have over 20 million cases and nearly 355,000 deaths. Almost every day this past week, we've been over 3,000 deaths. We're definitely seeing the surge from the Thanksgiving holiday, and it won't be too much longer until we see the surge from Christmas. So please, we've got New Year's coming up tomorrow. That's why we're doing this report one day early to finish out the year. So please stay home for New Year's. Stay with your family. Please, we don't want to see even more surges. But anyways, since tomorrow is the first day of 2021, I did want to do just a short report today, kind of like we did last week. I also don't want to focus too much on COVID-19 this week, especially since not a whole lot has changed since last week. I just want to mention a few quick things, though. First, the UK has approved the AstraZeneca vaccine. It's unknown how long it'll take other countries to approve it. Second, the new COVID-19 variant called B.1.1.7 has now been detected in quite a few countries, including the United States. They've had cases of it in both Colorado and California. It's probably in other places too, that they just haven't detected it. Like we said last week, though, it shouldn't really matter too much because vaccines should all be able to handle it just the same as any other variant. And also, if we continue following the guidelines, wear a mask, watch your distance, wash your hands, it affects this variant the same way. So just keep following those guidelines. Finally, for COVID news, the United States government has approved a stimulus bill and payments have already started being distributed. It'll take about a week to get the direct deposit payments out, and any paper checks will take even longer. There's a lot of different details on that. I guess the biggest detail is it's $600 per person that qualifies. That includes dependents, depending on ages, no limits as far as how many dependents you may have. But in order to get more information on that, please see the links below the video. The stimulus package that they put out did not have everything that we mentioned a few weeks ago in our report that should be included in a stimulus package. It also had a few things that really shouldn't have been there, especially in the much bigger omnibus package that got put out along with it. But we feel here at Plain English Public Health that it's better to get something out to help those that are truly in need than to not put anything out at all. If a few people get payments that don't need it, so be it. We really need to help those that are suffering right now. A lot of times we don't think about that as public health. We tend to focus more on the medical side of things when we talk about public health. But in reality, public health deals with a lot more than that. Poverty is one of the big things in public health. Public health experts are always trying to focus on figuring out ways to get people out of poverty because it affects so many other things. People that are suffering from poverty have a much higher chance of diabetes, all sorts of other diseases. It affects everything. So we really need to help those that need the help right now. So we here are glad that at least something was done. Even if it wasn't perfect, it's out. And we'll see, maybe the new administration coming in will make some different changes. Maybe they'll be able to make some things that are a little more specific to those in need. We don't know. We'll see. But anyways, there is that. So now, because of the tradition of setting goals for the new year and the fact that health-related goals, mostly weight loss, are some of the biggest or most popular goals each new year, I'd like to go over a few nutrition-related bits of news that were either this week or in previous weeks that we just never really got to. The links have been below the videos in the past few weeks, but we just never got to it in the actual video part of it. So first off, this week, the USDA set the new dietary guidelines for the United States. Not a lot changed, but that's actually a problem. The advisory committee, actually made up of actual scientists, they actually recommended a few different things. Among them was reducing the amount of added sugar that would be be allowed or recommended to be in your daily intake, and also they recommended lowering the number of drinks, alcoholic drinks for men, from the current 2 drinks per day to just 1 drink per day, the same as with women. And it's actually based on quite a bit of scientific evidence. They've had quite a few studies that show that that is an important step to take. They also stated that abstaining completely from alcohol is the best option. Of course, alcohol doesn't actually give us anything good that we can't get from other places. And it gives us a lot of bad, not just on the health side of things, but on the social side of things. A lot of domestic abuse and other things like that come about because of alcohol, or at least they're made worse by alcohol. So the politicians that make up the USDA decided not to follow the guidelines given by the advisory committee. They stated that there wasn't enough scientific evidence, which is totally not true. There was quite a bit of evidence listed when they went through that, when the advisory committee went through and made their guidelines. Basically, this is from the same administration that ignored the COVID-19 pandemic for months, stating that there wasn't enough evidence. So I guess that's kind of what we can expect. Hopefully this will change in the future. Regardless of what the official guidelines are, this New Year's and really all the time, please abstain from or at least limit your alcohol intake. Like I said earlier, you cannot get anything good from alcohol that you can't get from other sources that are much healthier, and it causes all sorts of problems. So moving on, much of the nutrition news this year has confirmed that a diet heavy in plants, meaning fruits, vegetables, legumes, whole grains, that's the healthiest option really for anything that we're eating. Also, many links between cancer and meat intake were discovered, making diets high in meat the types of diets that you want to avoid. For example, a lot of the diets that are high in meat are say the Atkins, it was from a while back, now it's more keto, paleo, things like that. Anything that's really high in meat, you really don't want to go with that. There are some options for keto that focus more on plant sources of fat. Jury's still out on that. But the Mediterranean diet has long been the gold standard for diets. Scientifically speaking, it's been the one that showed the most promise, not just for weight loss, but also for just generally being healthy. A few weeks ago, a new study showed that a diet referred to as green Mediterranean is even healthier than the original Mediterranean diet. The green Mediterranean diet is basically the same, except it has a much higher percentage of plant-based foods instead of the higher meat and dairy, animal-based foods. There was, along with that, though, in a separate study, a warning about vegan diets, going completely plant-based. Those who don't eat any meat or dairy products have a higher chance of experiencing bone fractures. This was even after taking into consideration any supplements vegans were taking to offset the lack of meat and dairy. Say, for example, iron or B12 or calcium supplements, things like that. So scientists believe that the discrepancy is due to how the body absorbs certain nutrients from animal sources versus plant sources or synthetic sources. For example, iron is much more readily absorbed from animal sources, from meat. It's called heme iron when it comes from animals, and heme iron it just gets absorbed almost directly compared to non-heme iron, which a small percentage of it gets absorbed. So you'd have to get a lot more plant-based iron than animal-based iron in order to get the same amount of iron that your body can actually use. Same thing with calcium. Calcium is found in quite high quantities in a lot of the green leafy vegetables, but because of different acids in those vegetables, it limits the way or the amount that can be absorbed. You don't have that problem when you're going with, like, say, cow's milk or other animal sources of calcium. So there's something to be said for both plant-based sources of food and animal-based sources. So to convert that all into a simple New Year's resolution, if you want to be healthy in 2021, eat more vegetables, less meat, but don't go fully vegan. Have a little bit of everything. Anything healthy, is totally fine. You don't have to get rid of all the meat, just limit it some. So thank you for watching the Plain English Public Health Weekly Report for December 31st, 2020. As always, the links below the video have additional information that we weren't able to get to today, and even more information about what we did get to today. So please check those out. I'm Richard Greenland, and you have a healthy weekend, and hopefully we all have a very merry and happy 2021.